Why can rhinoplasty recovery be challenging emotionally, even when things are healing normally? The nose is central to the appearance of your face, so even a really good result can be unfamiliar to the patient and sometimes disconcerting at first. Patients can have some uncertainty during the recovery because there's swelling, there's temporary asymmetries, daily changes that fluctuate, sometimes a little better, sometimes a little worse. This can lead to patients taking multiple selfies, checking the mirror incessantly, asking friends and family about it, or keeping it to themselves. But sometimes they kind of lose touch of where they started and the overall trend of the recovery. And so while they're focused on moment to moment, they don't realize that day to day and week to week, the improvement that they're actually accomplishing. So patients sometimes may focus intensely on small changes. They may look at their preoperative imaging photographs from the surgeon and expect to look like that much earlier than the final result is realistic. Patients sometimes will compare themselves to either friends or family they know that have gone through the same process or online photographs and expect to be on a similar or even better timeline. And sometimes that's just unrealistic based on their anatomy, based on what was necessary during the surgery, skin thickness, etc. The key part really is to have good communication with your surgeon about your concerns. They should feel confident that they understand why things are happening like they are and that there isn't anything going wrong with your healing process. Talking to your surgeon is going to be much more helpful than talking to other people on social media, online forums, etc., because they know your nose intimately. They know what the steps were taken during the surgery to accomplish your agreed upon goals. And so be forthright in talking to your doctor on your follow-up visits about your concerns, because they should be able to address those and help allay your fears, because this is probably not the first time they've done this. They've seen lots and lots and lots of patients go through this process before and have the same psychological hurdles to overcome. You're watching the center of your face change gradually. So yeah, the tissues need time to heal, but your brain needs time to adjust to seeing that change happen gradually. So I think that preparing patients for the emotional side of recovery is just as important as the physical side. So rhinoplasty recovery requires patience, both with the appearance of your changing nose, but also the overall balance of your entire face.